The World Health Organization is warning about the dangerous effects of high blood pressure. In a new report, the agency says the condition, also known as hypertension, is one of the world's leading risk factors for death and disability. The WHO says if controlled, 76 million deaths between now and 2050 could be prevented. Hypertension currently affects 33% of adults around the globe. High blood pressure can lead to strokes, heart attacks, kidney damage, a whole lot of things.
Yeah, joining us to answer some of our medical questions is ABC's Dr. Darien Sutton. Darien, thanks for joining us. We appreciate it.
Thanks for having me.
You know, 76 million is a massive number, and we know the dangers that are involved with the alcohol and smoking. Yes. What are the other issues that we got to watch out for that's creating this problem with hypertension?
Well, you know, hypertension is one of those things that's unfortunately common, and many people just don't realize that they have it. I think one of the most concerning statistics in those numbers is 4 out of 5 people who have it are not adequately treated. And so I think, number one, just understanding your numbers. The American College of Cardiology defines high blood pressure or hypertension if those numbers go over 130, over 80. That's those important numbers that we pay attention to with blood pressure. And if it goes above that, I often remind patients you don't feel it. And that's why we call it the silent deadly killer, many of which, unfortunately, people live with it and don't realize it. And if you have severe symptoms like a headache, chest pain, or any other symptoms that make associated with high blood pressure, that's when you have to come into the emergency room to see a provider like myself to make sure that we can rule out all those other dangerous causes.
And it can be easily treated.
Easily treated. You know, first and foremost, lifestyle, stopping and decreasing smoking, daily activity, at least 30 minutes a day for 5 days a week, avoiding alcohol. And then, of course, if you're still having difficulty controlling your blood pressure, taking your medication regularly. That's how it works the best.
You know, we tried to battle hypertension in my family for a long time. You know, my mom had it for many years, and it just kept getting worse. Eventually, she had a stroke. I mean, and you know the issues with anything like that. So there's really a focus not just on women, but on pregnant women. Right?
Absolutely. And up to 16% of women live or have hypertension or high blood pressure during their pregnancy. Incredibly important to manage, especially during those key months, mainly to protect the mother and the child. And we always remind mothers to be, when you're having high blood pressure, those numbers, again, are a little different. When we're talking about blood pressure in pregnancy, 140 over 80 or 90, if you see numbers higher than that, you should seek out attention and get help. And then, of course, taking your medications regularly and doing regular surveillance so that you make sure it's controlled.
We wanted to shift gears a little bit now. There has been so much focus this week on fentanyl and overdosing because of the tragedy that happened at the daycare center. Mayor Adams is now urging everyone to carry NARCAN.
Yes.
Are we at that level, and should just people with young kids be carrying NARCAN, and should it just become part of our everyday lives now?
You're talking to an ER doctor. So I think at the end of the day, for me, I think NARCAN should be in every first aid kit. NARCAN is that intranasal spray that can reverse the effects of an acute opiate overdose. That includes things like morphine, fentanyl, and heroin. And just as a reminder, it only takes a fraction of an amount of fentanyl to cause damage, a fraction of a raindrop. And so I think it's something very easy to use. And just as a simple reminder, these events, they often occur from ingesting it. It's very difficult to get from simply touching it, but I agree. I think it should be in every first aid kit.
It's just terrible that we have to have a conversation like this, possibly carrying NARCAN, or that children are being exposed to fentanyl. Dr. Darien Sutton, thank you so much for joining us and helping us with some of those questions. We appreciate it.
Thanks so much.